Hey, Dr. C here with you. I want to talk about the surprising benefits of IV therapy. My goal is always to find safe, natural, effective ways to get healthier and reverse a lot of chronic symptoms. And over the years, I've worked with clinics that have offered intravenous nutrients. And the data has evolved on this field. There was preliminary data back when, but overall the data has grown. And in this video, I'll talk through who might consider IV nutrient therapy, what are some valid reasons for that, what are some benefits one could expect, and how you'd go about using that. So for starters, let's give some context to this. There's a variety of nutrients the body requires, and we get those from our diet. Some of them we make inside as well. And those are made by secondary compounds, mostly in the liver or other organs. But yeah, a lot of essential nutrients and a lot of non-essential ones we make inside of us. Now, the ones we get from our diet, they're great, and there are cases in which we are low in them. And in those cases, raising them back up through dietary change or supplementation can make a really big difference. But, and this is a but, we can't achieve high levels of them through the diet. And that's okay. Normally our body has to adapt and regulate, but no matter how much we consume through diet or oftentimes through supplements, there's a limit in how quickly they come into our bloodstream. However, there are some cases in which it's useful to have things come into the bloodstream more quickly than our intestinal tract alone can do. Some big examples there are going to be nutrients that are harder to absorb, ones that we can't get in higher amounts. And this is where IV therapy can have some good benefits. The amounts that we assimilate are just greater than we can through dietary sources. And there are also times in which the intestinal tract is compromised and we can't take in as much as would be ideal through diet or supplementation. And then the other consideration is the quantities that we take in, the blood levels we can achieve can be higher. And there are some cases in which that can be beneficial and useful. So for starters, I want to talk about some situations in which nutrients are poorly assimilated, in which people may consume enough in their diet or through supplementation, but too little enters into their bloodstream. One of the most common ones for populations I work with is autoimmune gastritis. This is also called thyroid gastric syndrome. This is an autoimmune condition in which the cells that generate hydrochloric acid to break down nutrients and mucin to protect the stomach lining, they're both damaged. The immune system damages these cells and it can't make those compounds effectively. The result of that is many nutrients cannot be assimilated, even if the diet or supplementation contains high enough amounts. There's a sequence to this. There's actually an order in which nutrients tend to get low with autoimmune gastritis. The first one to fall off is iron. So in almost all cases, that's the initial one that gets compromised. People may have enough in their diet, they may take appropriate supplementation, but they remain low in that. And when that occurs, intravenous iron can be life-saving and life-changing for people. Some can struggle for a long time with thin hair, fatigue, weakness, coldness, poor sleep, headaches. These can be all signs of iron deficiency. And yet some people don't see those things improve from high iron diets or even iron supplementation. But intravenous iron never doesn't work. It's going straight in the bloodstream. There's just no middlemen involved. If given in appropriate dosages, it can reverse iron deficiencies in a matter of days rather than weeks and weeks and months. Next up, when iron gets low with atrophic gastritis, after that, B12 tends to drop off. This is a different B vitamin. It requires a carrier protein to absorb. That protein is called intrinsic factor. And no matter how much B12 you take, it doesn't get into your system until intrinsic factor can bind up with it. So the massive megadoses aren't necessarily more effective. Now, interestingly enough, it turns out that most people with functional intestinal tracts can assimilate B12 in oral form, but some simply cannot. And in those cases, intravenous or intramuscular can be quite useful. After that, there's a long list of things that can drop off. Zinc is common, as are other trace minerals, including selenium. Then we think about celiac disease. This one happens as well. This is probably 3 to 5% of those with autoimmune thyroid disease. And this can also affect the absorption of trace minerals and some essential amino acids. And we also consider irritable bowel syndrome and inflammatory bowel disease, so IBS and IBD. They're pretty similar names, but they're quite different processes. With irritable bowel syndrome, there's not a chronic inflammatory response, and the structure of the gut is normal, but the nerve signals that travel throughout the gut are not. So there's not the right sequence of events allowing proper nutrient uptake. And sometimes, especially with IBS prone to diarrhea, we can see poor assimilation of nutrients and a greater require for micronutrients that cannot be easily met orally. With inflammatory bowel disease, as the name suggests, there's inflammation. The gut itself is being physically damaged. And over time, that can make it to where it loses the surface area it needs to properly connect physically with the breakdown of digestion and allow those nutrients to enter into the bloodstream. If you could take the small intestine, its villi, which on their surface are villi, which on their surface are villi. So it's a super complex, high amount of surface area in a small amount of mass. If you could theoretically flatten out the small intestine of one adult, you've got the surface area of a football field inside. No kidding. But with inflammatory damage, these little villi on villi and villi, they break down and they get stubby, and a massive amount of surface area is lost. And that means there's just less of an opportunity to properly bring nutrients into the bloodstream. And this is most commonly manifesting in Crohn's disease and ulcerative colitis. In some cases, people also have surgeries for these in which portions of the bowel are taken. And of course, that further compounds the loss of overall surface area. So thinking through the things that one can benefit with that, we also think about the idea of hydration, the needs for overall nutrients, and then also the requirements for fluids in the body and things that are poorly assimilated. We'll touch a bit more on all of those. For energy, we can also see some valid applications. In this case, there are ways in which we generate energy that can become rate limiting due to certain nutrients. Some big ones are NAD, glutathione, selenium, B12, and zinc. Now, some of them, like NAD and glutathione, are things that probably don't work at all when taken orally because they're broken down into constituents, but intravenously bypasses that intestinal breakdown process. So these things can survive intact, they can reach the bloodstream, and one can make a big difference helping how much is there for energy generation. And then we think about, too, other parts of the body and other processes that can benefit. So we mentioned energy production, but nerve conduction, cognitive function, exercise capacity, these are all things that can benefit by healthier amounts of some of those key antioxidants. And these are ones, especially like glutathione, these are ones that our bodies normally make inside of us. And we can't change them much by taking them in pills or even creams or lozenges, but we can raise those amounts directly in IV form. And that can be useful in these various ways. And then we think about intravenous treatments for hydration. For a lot of years, I practiced in the Sonoran Desert, and a lot of people were chronically dehydrated. And that can happen even if you're not thirsty all the time. You can be behind on fluids in ways that can affect you. And apart from fluids, we think about some of the key electrolytes: sodium, potassium, magnesium, calcium. And magnesium's a big one. That's a tricky one to get a lot of it quickly orally because too much causes diarrhea. So if you're chronically low in magnesium, it's hard to build it up without just giving yourself loose stools and having it not do much of anything. But I had so many cases of those that had chronic fatigue and chronic muscular pain from low magnesium, and they would be diagnosed with fibromyalgia. They would be even debilitated from that. And I saw firsthand how often intravenous magnesium could be life-changing. For the first time, they could build their levels back up again and feel healthy and feel normal again. And then last up, we think about the relevance of thyroid function. So one correlation is that a lot of these digestive issues are very common. The autoimmune gastritis, the celiac disease, they're more typical. And then we also think about the way in which the thyroid has a unique need for certain nutrients. Big ones there being iron, selenium, zinc, B12, glutathione. Glutathione we make, the others we get from the diet, but there are times in which we run low in them. And for some, like iron, we may not be able to assimilate it very quickly. For others, it may take a long time to build up an overall deficit. And what these nutrients do is they allow for proper functioning of the deiodinase enzymes, also called DIO for short. These regulate how thyroid hormones circulate throughout the body, how they're taken up by cells, and how they're eliminated. This can also make a big difference for the repair of thyroid cells. Having good amounts of the right nutrients means the thyroid cells can fix themselves. Cells can fix themselves, that's tricky, when they need to, when they're ready to regrow again. So who's a good candidate for this? Well, those who are traveling, those who have immune issues, those who have chronic inflammation, those who have malabsorption. These are all good considerations, and this is a way in which one can safely help to reverse symptoms more quickly and get to a place in which easy lifestyle measures can make a bigger difference. All right, so Dr. C with you, and those are some of the big benefits of IV vitamin therapy. We'll talk again really soon. Bye-bye.